Reach West Virginia, or Racial and Ethnic Approaches to Community Health, is part of a national movement that's spearheaded by the U.S. Centers for Disease Control to eliminate health disparities among our racial and ethnic minority populations.
The focus on disparity actually recognizes the fact that even though in this state African Americans are approximately 3.5% of the population, we represent an unimaginable percentage of individuals who are affected by specific diseases, and in this instance we're talking about diabetes.
The main goal is to affect behavioral, environmental, and systems change through what we call a community-based participatory approach. Everyone is involved in the process and everyone becomes a part of the solution.
We're creating community coalitions in 5 counties in southern West Virginia. We've been working with residents in McDowell County, Kanawha County, Fayette County, Mercer County, and Raleigh County. And in each of those counties, at least one coalition will be developed. The coalitions are bringing community members from all walks of life together.
For the first time, the community that is saddled with the disparities themselves are being asked to take a leading role in developing solutions, which is extremely important. We've tried the top-down approach for years and years and years, and that has proven to be ineffective and not work. So with the REACH program, the communities, those disparate communities, are actually driving the process from data collection all the way to program design as well as implementation.
A lot of people don't feel that necessarily that health is something that you can actually manipulate, and then you can actually have better health through the way you live, and that you're not necessarily just destined to become a victim of some sort of chronic illness. So by taking some steps to change some lifestyles, I think maybe there's a lot of opportunity for improvement there. Because
our REACH coalitions can look at things like whether there is fresh fruit readily available in stores and communities, or whether there's a safe place to walk, if there's sidewalks, if there are lighted streets. All of those things, believe it or not, are within the realm of our coalitions to look at, address, and attack in their own communities.
Help us help you. That's exactly what we want to do. Help us help you. And the only way that you can do that is participate and come out when we have our meetings and different things, and we will come to you also.
We're hoping that the community, that our entire community will become aware of those things that they need to do individually in their own homes, in their own kitchens, to make sure that they're eating healthy, that they're taking care of their needs as they arise, and you don't put it off until tomorrow.
Let's start making a change. Let's stop talking about it, and let's make a change. Start small, helping someone else, calling up a friend, say, hey, look, we both overweight, let's get together and go down to the gym, or let's get together and find somewhere that we can work out together, if nothing but go walking.
The Fayette County Coalition, we're working on now to try to get a youth program started, because we feel like if we teach them and empower them at an early age, then that will stop the diabetes rampant that is going through our community so fast. We're going to also do a cooking class, teach them how to eat, teach them what to eat, stop eating the fried foods that African Americans love so much, the fatty foods, the way we cook. Teach them how exercise is so important for them, not just to sit in and play the games on the TV, to get out and participate in sports.
Just not providing information, but also doing follow-up, making sure these people are going to the doctor, they are meeting their appointments, they are recognizing even symptoms.
If we could get into the hospitals and clinics and explain to the doctors that they need to be able to communicate with people on their level, that would help also.
Once you start educating people about the real issues and are able to substantiate it with data, then you're able to start working on policy and impacting systems change through policy.
Data is important because we live in a data-driven society. And the new buzzword in health is data-based decision making. So people make decisions not based on how we feel about certain things or what we suspect, but we actually need hard data that actually tells us what those conditions are so we can make decisions accordingly.
Once we reach these communities and they are healthy and we introduce them to the program and they can see the benefits of the program and take advantage of the benefits, that alone is a marketing tool that will encourage others. So the old saying, if they did it, we can do it.
People are coming out because of their concern for their community and because they want to make a difference. I feel that it's our job, our role, to provide whatever supports are needed to enable that difference to be made. And I'm looking forward to the next year to seeing some amazing things happen in each of the communities that we're focusing on.
The main goal of Reach West Virginia is to mobilize community coalitions to move from health disparities to health equity, because this is a movement and not an event.